Okay.
May I please know your name?
Is that Naji's
Joma.
hand? Oh, this is too big.
Have you ever had blood drawn before?
That's not nice.
So of course, you have to have the requisition form, right? You're trying to compare, match, everything. Okay, so everything that if the patient asks, is it painful? Okay. So
Yeah,
you-
it's painful.
Okay.
It's
So which arm do
painful.
they usually use? So both hand, right arm, but then remember you have to check both.
Yeah, I was
Because
gonna
it
say
will
that.
be you who will be, okay, choosing which arm or which vein to use. You're the one who is now presently in direct, okay, examination of the hand of the or arm of the patient. So you're now ready to palpate. So how am I going to? May I just lift your arm? Naji, okay.
Yeah, you
I'll
lift your
just-
hand.
So remember, you have to ask if the patient has allergy also, just in case. Okay? So do you have any fainting episodes? Remember all those questions? Are you taking any medications? If the patient says, yes, I'm taking aspirin, remember it is a blood thinner, so it can cause the blood to clot longer. So it will take for a while before the blood clots. So that will give you, okay, a heads-on, so to speak, to apply the pressure after you remove the needle longer. Okay? And then go back to the site to see if there is bleeding. Okay? Then you're now ready to tie the tourniquet. So how do we do it again? So 3 to 4 inches above the antecubital crease. Right? It's up to you. As I've said, as you go along with your practice, you will have your own technique. Develop your own technique. So now, as beginners, we can do it using our two-hand method. Okay? So I'll try to palpate. Oh, the vein is here. Okay? So the vein feels firm, bouncy. Okay? So even if sometimes without that, you will see a big vein. But it's always advisable that you still do it with the tourniquet. Why? Because sometimes you might see it as big, but when you palpate it, you will feel that it's actually a fragile vein. Okay? So it's advisable that you do that. So I did the other arm. This is a better vein for me. Okay? So I'll remove now the tourniquet. Okay? And then we have to clean the side. Remember, we said that the wearing of the gloves, according to OSHA, they didn't tell when during the procedure you should be wearing the gloves. Okay? But according to the CSLI, they say that once you are ready, okay, to clean or cleanse the area with your antiseptic, you already have your gloves. Okay? Because it's hard to palpate with the gloves sometimes. Okay? So we're now ready again to clean the area. So this is my target. So start it from that target point, and how do we do it? Do it in a concentric circular manner. Okay, covering about 1 inch or 2 inches, okay, around the area. Okay, we let the alcohol dry while also we're letting, right, the blood to recirculate, and then we apply it. While you are waiting for the alcohol to dry, okay, make sure that the seal is not broken, okay, and then you have to open this, right? Assemble your equipment. When I say assemble your equipment, you're waiting for the alcohol to dry. Connect this, okay, then the alcohol is dried now. No needle is out. Okay, it's still covered. Get that? So if you think the patient needs bandage, you will open this also ahead of time, but we will not do that. Okay, I have the gauze and everything. Now I'm ready to reapply the tourniquet. Okay, so since my vein is over here, I have to move this over here so that this will not be getting in the way. Okay, now after that, I will have to open this and see for any manufacturing defects. Right? So if you see any dirt, any nick there, anything that you are not sure of, then just get a new one.